And we're back on Second Street talking with Matthew Lister. He's an executive health system consultant. Matthew, before the break, we talked about your tour across Canada in an ambulance to hear from Canadians directly about the system. Let's talk now about sort of your prescription for reform. What do we need to change to improve the system? I want to ask you just sort of generally, because we are seeing some changes happening in this country to try to reduce wait times. I mean, we're seeing in Ontario and many other provinces, there's more partnerships happening with non-government providers to deliver care to patients in the public system. Quebec and now Alberta are spending more time with activity-based funding, so changing how they fund the healthcare system to incentivize output. When you think about the big picture, and there's other changes happening too, do you think like that we're heading in the right direction or not?
I think we are heading in the right direction. I think we're seeing a lot of more positive attention being paid to the issues, particularly around three
Mm-hmm.
areas. The first is accessibility. The second is what
Mm-hmm.
patients need and patients' ability to access care. Those are actually separate from accessibility. It's not just an academic distinction. And the third one that
Mm-hmm.
is vital to all of this is the workforce. The workforces that we absolutely need to make sure that we have accessibility and that patients are properly looked after and have the care that they need preemptively, not just when they're in a more urgent state of need.
Let's talk about the workforce element because you're right. I mean, the healthcare system is nothing without doctors and nurses, people that actually provide services to us when we need healthcare. What do we need to do to either train, recruit, or retain more healthcare workers in this country? I know it's a big question, but are there any big
Yeah.
picture solutions that you think we need to do more of that maybe we're not doing right now?
Well, let me take a step back and maybe reposition the current thinking around our health system. We tend to think
Mm-hmm.
of it as a social service. I think we need to think of it more as an economic driver. And that's not to say, because I'm sure that many people will jump on that and say, oh, it's a privatizer or turn it into business. Actually, when you cannot talk about healthcare reform, you cannot have a meaningful, thoughtful discussion about healthcare reform without looking at how it's financed, just to say how the entire system is financed, how payments are made, how it's regulated, how it's organized, and then what the actual behaviors, the
Mm-hmm.
dynamics of the workforce are. And within those different domains, the workforce, as you say, the workforce is an absolutely vital part of that. So when it comes to issues like recruitment, we tend to think very much of interprovincial or who's in Canada. We have an enormous pool of internationally educated medical graduates, nursing graduates, pharmacists who are very eager to contribute to the Canadian workforce. We already have a very high
Mm-hmm.
proportion of those international professionals working in Canada, with the exception of nursing, where we're still below 10% on average. But physicians make up internationally trained physicians make up about 27% of the physician workforce across Canada. The pharmacists are about 35%, and the nurses are around 9%. So we have an opportunity with the internationally educated graduates. But then we also have opportunities in terms of how they are set up. There are very distinct levels and changes of pay between different sectors and between different provinces. And so that's an issue that I think we need to address as well. We need to raise the awareness of the qualifications and the value of the qualifications and credentials to a national level so that it's not done province by province. Did you know that there are 22 different regulatory groups for nurses across the country? And that's why it's
No.
really no surprise that the Canadian Medical Association, the Canadian Nurses Association, I believe the Canadian Pharmacists Association as well, are calling for pan-Canadian licensure. So I think that is a very positive step forward.
Mm-hmm. So in plain English, that means once you become a nurse in Canada, you could practice anywhere across the country. Is that the idea?
Yes.
Yeah. Okay. What is there? We've got about 40 seconds here, but what is there a particular other change that we need to make it easier to get people to get their licenses once they're coming in from other countries?
Yeah, there are a number of things that we can change. We still administer it on, with the exception of the Maritimes, on a province by province basis, and then look at the national credentialing process. I think we're at a stage now in the
Mhm.
maturity of our health system where we can look at decreasing the provincial involvement, or at least maximizing provincial capacity so that one province does one thing, another province looks after something else.
Mm. Interesting idea. Okay, when we come back, we'll continue to talk about how we can fix the system.